Welcome to this video on global medical service delivery. Today, we explore how cutting-edge technology and virtual hospital ecosystems are building more sustainable and continuous modern healthcare systems. The outlook of healthcare is shifting toward virtual hospitals and continuous remote patient monitoring. This evolution includes hospital-at-home models, which allow patients to receive acute, high-quality care safely from their own homes. Our foundation starts with the evolution of virtual hospitals. We will examine the history of telemedicine and the vital role of continuous health tracking technologies. Historically, healthcare was centralized, but this often led to issues like overcrowding and higher operating costs. These limitations helped drive the adoption of modern telehealth. The rise of the hospital-at-home model is powered by technology that shifts care into supportive patient environments. Benefits include cost-effective care and reduced risks, a shift accelerated by the global pandemic. Understanding remote patient monitoring, or RPM, is essential. It uses accurate digital tools to track metrics like blood pressure and heart rate in real time, facilitating recovery at home. At its core, RPM involves collecting health data outside of traditional settings. This includes monitoring blood pressure, oxygen levels, and continuous respiratory tracking. Various tools support RPM, ranging from wearable devices and smart sensors to mobile apps. These integrate with secure cloud platforms to ensure data flows seamlessly between patients and their clinical teams. Advanced analytics and AI are transforming patient monitoring. By identifying health patterns and predicting clinical deterioration, AI enables a shift from reactive to proactive, predictive medicine. Virtual hospitals implement this care by leveraging remote monitoring and digital platforms. Key components include continuous biometric monitoring and access to rapid response clinical team. Effective medical workflows in a virtual hospital involve patient enrollment, continuous remote assessment by clinicians, and tight care coordination to manage interventions. Patient selection is crucial. Hospital-at-home programs are ideal for patients with specific acute conditions who do not require intensive procedures. Onboarding ensures patients and caregivers are prepared. System integration is the backbone of these programs. This requires connecting core infrastructure, like electronic health records, with active care partnerships to ensure absolute continuity of care. The clinical value of these systems is significant, offering continuous vigilance, greater patient comfort, and optimized hospital capacity by freeing up resources for high acuity cases. Ultimately, these programs lead to improved clinical outcomes by reducing risks and complications while enabling prompt medical intervention through proactive monitoring. Moving to the benefits, we see an elevated patient experience. Patients often recover better at home, surrounded by familiar support systems, which significantly reduces the stress and anxiety typical of traditional hospital stays. Virtual care models also drive active empowerment. By participating directly in their own care pathways, patients feel more connected to their medical team and engaged in their recovery journey. From a financial perspective, virtual care delivers significant value. By minimizing reliance on physical inpatient beds and daily facility maintenance, healthcare systems can reduce operational costs substantially. These efficiencies lower overall healthcare expenditures for payers and providers, allowing for better allocation of funds while maintaining or even enhancing the quality of care provided. Virtual hospitals are also powerful tools for increasing access to care. Through RPM and telemedicine, we can bridge regional barriers, bringing specialized clinical expertise to rural or underserved communities. Furthermore, these models offer rapid scalability. During public health emergencies, virtual infrastructure allows health systems to expand capacity quickly, ensuring care continuity even when physical resources are severely constrained. However, we must address challenges. Navigating complex regulatory landscapes, licensing across state lines, and ensuring strict compliance with patient data privacy standards remain critical hurdles for widespread implementation. Integration also requires effort. Moving from legacy electronic health record systems to modern, agile digital platforms is a significant task, as is ensuring technology adoption among both staff and patients. Technological barriers, such as maintaining reliable network connectivity and achieving seamless interoperability between diverse medical devices and health systems, are essential areas for continued technical investment. Security is equally paramount. We must safeguard patient data at every point, while also addressing the digital competence gap for those less familiar with new technology. Clinically, we must recognize limitations. Hospital-at-home models are not suitable for all cases, specifically excluding high-acuity conditions that require immediate surgical access or intense, in-person monitoring. Therefore, rigorous patient selection and stratification protocols are non-negotiable. These ensure safety and help maintain high standards for clinical outcomes across the board. The regulatory landscape for reimbursement is also evolving. Clear, structured policies regarding credentialing and payment are essential to ensure the sustainable delivery of high-quality, safe, and equitable virtual care. Data security goes hand in hand with these regulations. Transmitting sensitive health data requires end-to-end encryption protocols and frequent audits to maintain patient trust. Finally, maintaining compliance with standards like HIPAA is critical. These processes are not just administrative requirements. They are fundamental to protecting users in our digital healthcare future. Moving to policy and workforce development, collaboration is key. Policymakers, educators, and healthcare organizations must work together to establish standard frameworks, train specialized providers, and address the evolving needs of the modern medical workforce. Strategic infrastructure is equally vital. Continued investment in digital networks and ensuring equitable access to technology will be the foundation for guaranteeing the long-term success and sustainability of virtual hospital systems. To conclude, virtual hospitals and remote monitoring represent a major shift in healthcare. By providing care at home, ensuring universal access, and focusing on proactive health, we can establish a highly accessible and patient-centric standard for the future. Thank you for your attention.